So one of the most commonly asked questions in the psychiatric practice of all psychiatrists, I think, is, I don't want to take medicines. Will counseling work in my case? Or rather, I really want to take counseling. I don't want to take medicines. How will counseling help me? Dr. Priyal.
This is a recent fact that has come up, and it has been actually shown in a lot of movies also, where sitting on a couch and talking to a therapist solves all your problems. There is a huge difference between taking advice from someone and taking counseling. So, let me start with whether counseling will work for you or not. Counseling works in very mild cases of depression or anxieties or situation related issues wherein resolving the situation might help you get out of the problem. Counseling is not equal to giving advice, which is what people believe nowadays. Counseling is a very defined process wherein the process starts with insight orientation, where we tell you about yourselves, we help you understand yourself, we help you understand what you're feeling. The next step would be how to change yourself. Counseling is not about suggestions, it is not about giving you a direct advice. So, no one can come to me and say, please counsel me on whether I should continue dating this boy or should I break up. I cannot tell you whether you should continue dating or you should break up, but I can tell you how to take a decision. Counseling is not just one way, there are different types of counseling. The type of counseling is also decided based on the type of problem that you're facing, and usually it takes not less than at least 4 to 6 sessions for you to actually come out of whatever you're going through. And hence, this new recent trend that has come up, that I'm going to see a therapist, I'm going for counseling, that is very different from taking advice or actually taking treatment for a psychiatric illness. A psychiatric illness cannot be treated with just counseling, and in almost all cases, I think if not all, in most cases, counseling is an addition to treatment. It is not a substitute for the treatment. Also, I would say that if you are going to a doctor for their opinion, do not go with a notion, a preconceived notion that I do not want to take any other form of treatment but just counseling. You're going to a doctor, take their opinion, let them decide for you what works best for you. If counseling is going to work for you, they will suggest that. But if it is not going to work, take their opinion. That would be better than deciding for yourself whether you want just counseling or not.
Thank you so much. So let us try to understand this better with an example. So, Dr. Priyal, a patient comes to you, the young boy who's been in a relationship for a few years. They've recently broken up. He's extremely sad. He's crying. He's not feeling good about himself. He's not feeling good about everything that is happening around him. How will you approach the case? How will you decide whether counseling is what is required in this case or it is medicine that are required in this case?
So, first of all, I will have to go through the symptoms that he is facing. Symptoms, like I said before, that if I want to diagnose him, I will have to go through a certain criteria, whether he is actually depressed or he is just sad about his relationship probably breaking. If he is just sad, then yes, counseling will work in his case. But if he is showing signs of clinical depression, then I will not say that only counseling will work in your case. A lot of times, patients are suicidal because of relationships, and there are parents who feel that it is not a big deal. I mean, he is just saying that, but he will not do it. You cannot say that for sure. We have had patients who have actually made attempts of killing themselves because they were in a long term relationship, they broke up, and they couldn't cope with it. So, this will depend on the extent of the illness, on the severity of the illness, and not just this much that because it was a relationship and he's going to break up, so it is a situation based thing and it can be cured just by counseling.